A nurse is putting together an educational seminar on advance directives. What information would be included in the materials? A. A patient may change a treatment decision in an advance directive if the patient's healthcare agent approves the change. B. When admitted to the hospital, a patient must appoint a durable power of attorney for healthcare decisions. C. A healthcare facility must provide a patient informational material advising them of their rights to declare their desires concerning treatment decisions. D. A healthcare facility is required to provide a patient an attorney when the patient is signing a living will. The answer is C. A healthcare facility must provide a patient informational material advising them of their rights to declare their desires concerning treatment decisions. Under federal law, all healthcare facilities are required to provide patients with information on how to make medical decisions under federal and state law, including accepting or refusing treatments and creation of an advance directive. The patient has the right to change a treatment decision in an advance directive, regardless of whether the patient's healthcare agent approves or denies the change. It is the patient's right to appoint a durable power of attorney at the time and place of his choosing. It is not required for entry to a hospital. The healthcare facility is not required to provide an attorney to a patient to sign a living will. The patient needs to determine which attorney they want to hire or if they want to hire an attorney. A nurse is advising a patient with chronic fatigue syndrome on infection control procedures. Which of the following statements by the patient indicates that the patient understands the advice? A. I'm going to a basketball game tonight. B. I should avoid anyone with cold symptoms. C. I should have a blood test. D. I'm not going to attend functions with large crowds. Answer is B. I should avoid anyone with cold symptoms. A patient making this statement understands that one step in infection control is avoiding patients who have cold symptoms. This is important as the person with chronic fatigue syndrome may be more susceptible to a virus or the virus may trigger more disease symptoms. The patient who verbalizes they are not going to the basketball game or are going to avoid functions with large crowds may understand that chronic fatigue syndrome can cause the patient to become tired, but this does not indicate the patient understands infection control. Infection control measures can be implemented at events by following standard precautions, such as hand washing. If the patient stops going to social events, this can also cause the patient to become depressed and isolated. Infection control statements would more accurately be made about prevention of infection. A blood test would only indicate if the patient already has an infection. Which of the following would be an expected finding in an age assessment of a 2-year-old? A. Has a 300-word vocabulary. B. Uses one hand to turn the pages of a book. C. Runs with a wide stance. D. All of the above. Answer is D. All of the above. At 2 years old child, a patient should have reached certain developmental milestones. The child will be developing their vocabulary and in addition to knowing almost 300 words, will be developing 2 to 4 sentences. The child may start using one hand to complete tasks and favoring one hand over the other. The child may start running, as well as walking and standing on tiptoes. A child who is lagging in performing these milestones may be at risk for developmental delay and further assessment is indicated. A patient's spouse died 3 months ago. The patient says, I would like my friend Tom to have my collection of artwork because I don't need to look at them anymore. Which of the following responses by the nurse would be proper? A. Did Tom ask for the artwork? B. Are you planning to commit suicide? C. Does Tom know you want to give him the artwork? D. Why do you want to give the artwork away? Answer is B. Are you planning to commit suicide? It is appropriate for the nurse to ask this question of the patient as a close-ended question with 2 responses. The nurse can decide based on the patient's response if further evaluation is needed. As to the other answer options, the focus should remain on the patient, as it will be easy for the patient to sidetrack a conversation. In answer option D, it is an open-ended question and gives the patient an opportunity to evade further questions about the patient's plan to commit suicide. A nurse is instructing a patient on the use of a walker. Which of the following would be included in the instructions? A. While putting your body weight on your hands, step into the walker. B. Hold the upper hand grips. C. When seated, push off the chair to come to a standing position. D. All of the above. Answer is D. All of the above. All responses are appropriate for the nurse to instruct the patient in the use of a walker. It is appropriate for the patient to put the body weight on their hands, or onto the walker, as this will put less pressure on the weakened leg or legs. The upper hand grips are where the patient should hold the walker, not on the front of the walker, which could cause it to tip forward, or on the middle side rails, which are too low. The patient should push off of the chair to come to a standing position, not pull the walker to stand up, as this could cause them to fall as the walker tilts back. A patient, who weighs 200 pounds, has a prescription for a dopamine drip at 5 microgram per kilogram per minute. There is 400 milligrams per 500 milliliters D5W on hand. How many milliliters of infusion does the nurse have to administer to the patient each hour? A. 17. B. 24. C. 34. D. 44. Answer is C. 34. Weight of patient in kgs equals 200 over 2.2 equals 90.7 kg. Dopamine to be given per minute equals 90.7 multiplied by 5 microgram per minute. Dopamine to be given per hour equals 90.7 multiplied by 5 multiplied by 60 equals 27,210 micrograms per hour equals 27,210 over 1,000 milligrams per hour equals 27.21 milligrams per hour. 400 milligrams of dopamine is there in 500 milliliters of D5, so 1 milligram of dopamine is there in 500 over 400 ml of D5, so to give 27.21 milligrams per hour, we need to give equals 500 over 400 times 27.21 equals 34 milliliters. A patient is to get an MRI of the abdomen. Which of the following instructions should the nurse give the patient? A. Do not wear metal objects during the MRI, including jewelry. B. Do not take oral medications up to 12 hours after the MRI. C. Do not urinate prior to the MRI. D. Do not eat solid foods 12 hours prior to the MRI. Answer is A. Do not wear metal objects during the MRI, including jewelry. Metal objects should not be used near an MRI. An MRI, or magnetic resonance imaging device, will not function properly when magnetic objects, such as jewelry, are nearby, and can cause harm to the patient through the MRI pulling the objects away from the patient. Patients should be assessed for metal materials within the body as well, such as joint replacement or spinal hardware. Unless otherwise instructed, it is safe for a patient to take oral medications, eat solid foods, and urinate as usual prior to getting an MRI or following an MRI. Which of the following symptoms would support a diagnosis of Crohn's disease? A. Fatigue and headache. B. Rectal cramping and bleeding. C. Stomach swelling and gas. D. All of the above. Answer is B. Rectal cramping and bleeding. Rectal cramping and bleeding would be the most consistent in supporting a diagnosis of Crohn's disease. While it is unclear what causes Crohn's disease, patients almost always present with these symptoms. Fatigue and headaches could result following blood loss and Crohn's disease but would not be used to make a definitive diagnosis. People with Crohn's disease may experience stomach swelling and gas. These are also symptoms of all types of IBD. They would not necessarily be used to make a diagnosis, as these symptoms are present in many other intestinal-related diseases. A nurse is teaching a staff seminar on patient confidentiality. Which of the following statements would be included in the presentation? A. Verbal consent is sufficient to allow family members to see a patient's medical records. B. If a family member is at the hospital, he or she would be entitled to an update on the patient's status. C. All hospital staff may have access to a patient's medical records. D. Consent to disclosure is implied when a patient is transferred from one health provider or facility to another. Answer is D. Consent to disclosure is implied when a patient is transferred from one health provider or facility to another. Consent to disclosure is implied in the transfer from one health provider to another for continuity of care under HIPAA laws, as long as the facility members receiving the patient health information, or PHI, are directly involved in the care of the patient. Consent must be in writing from the patient to allow the family members to see the patient's medical record or receive information from care providers. Updates on the patient's status should only be given with consent from the patient. This includes all family members, even a spouse. Under HIPAA laws, only staff operating in the direct care of the patient are allowed access to a patient's medical records. A patient has a prescription for Tylenol at 650 mg every 6 hours. A nurse only has 325 mg pills of Tylenol available. How many pills would be administered every 6 hours? A. 2. B. 3. C. 4. D. 5. Answer is A. 2. Strength at hand equals 325 mg. Dose required equals 650 mg. Tablets required equals 650 over 325 equals 2. A patient is suffering from heart failure. Which of the following would be recommended by a nurse as part of the patient's healthcare plan? A. Discouraging a diet of fruit and vegetables. B. Checking for swelling of the lower limbs. C. Encourage the daily intake of fluids. D. Encouraging vigorous exercise. Answer is B. Checking for swelling of the lower limbs. Swelling of the lower limbs, known as edema, is due to a buildup of fluid from an impaired circulatory system and is a common side effect of congestive heart failure. It would not be appropriate to discourage fruits and vegetables, as they are part of a heart-healthy diet and should be encouraged. Patients with heart failure are usually put on a water regimen of around 1 to 2 liters of fluid total per day. This is due to the increased pressure on the heart to process fluids and may cause worsening edema. Patients with heart failure need to be careful with the amount of vigorous exercise activities they undertake. Heart rate should be monitored closely to prevent overexertion. A patient has had diarrhea for the past 72 hours. Which of the symptoms would support a diagnosis of hypovolemia? A. Light-colored urine output. B. Decreased pulse rate. C. Wet mucous membranes. D. Dizzy spells. Answer is D. Dizzy spells. Hypovolemia indicates low fluid volume within the body. Dizziness spells would be one symptom of hypovolemia due to the decreased pressure in the brain. Urine would be dark-colored, not light-colored, as the urine contains more byproducts and the kidneys process less fluid. An increased pulse rate would indicate hypovolemia as the heart works harder to spread the limited amount of fluid volume throughout the body. A patient would have dry mucous membranes as fluid is directed towards more vital body organs. The spouse of a patient in a long-term treatment facility asks a nurse for information about the patient's treatment plan. The nurse should respond as follows. A. Ask the patient for the information. B. I cannot give you information on any patient. C. The doctor will speak to you about the treatment plan. D. Can you give me the patient's social security number? Answer is B. I cannot give you information on any patient. Unless the patient has given consent for information to be given to the spouse, the nurse should respond that no PHI, or protected health information, can be given out. Treatment plan information would be considered PHI under HIPAA. It would not be appropriate to direct the spouse to the patient for the information. The nurse should already be aware of the treatment plan information and can ask permission from the patient to speak to the spouse. It is not appropriate for the nurse to pass the buck to the provider. In this scenario, the nurse should tell the spouse that information cannot be given. Even if the spouse knows the patient's social security number, the patient's PHI is protected under HIPAA. Which of the following infectious control methods should be used when caring for a patient with bacterial pneumonia? A. Wear a mask when taking vital signs. B. Do not allow flowers in the patient's room. C. Require the patient to use disposable eating utensils. D. Do not allow visitors. Answer is A. Wear a mask when taking vital signs. A patient with bacterial pneumonia may spread the disease through droplets from coughing or sneezing. Droplet precautions would be appropriate. A mask is required to prevent inhalation of droplets containing bacteria. Flowers can be allowed to be brought into the patient room as this should not worsen the patient's condition, unless the patient has an allergy. Proper sanitization measures are acceptable when handling utensils used by a patient on droplet precautions. Visitors can be allowed provided a mask is worn within the room of a patient who may be coughing. A patient is brought to the emergency room by her spouse. The patient's injuries are indicative of physical abuse. Which of the following actions should be taken by the nurse? A. Question the couple about how their marriage is going. B. Inform the spouse that the patient's injuries appear to be the result of abuse. C. Inform the patient that she will have to speak to the police. D. With the spouse out of the room, question the patient about the possibility of abuse. Answer is D. With the spouse out of the room, question the patient about the possibility of abuse. Using therapeutic communication, the nurse should question the patient about the possibility of abuse. It is appropriate to talk with the patient when the spouse is out of the room, as the patient may be fearful and not answer questions honestly if the spouse is in the room. It is not appropriate to question the patient when spouse is in the same room. It is not appropriate to approach the spouse with suspicion of abuse, as this could cause further damage to the patient and make it more difficult for the patient to leave the abuser. The patient is not required to speak to the police. It is up to the patient to determine if they want to speak to the police, though the nurse can encourage the patient. Which of the following advisements should a patient suffering from GERD receive? A. To eat high-protein, low-fat foods. B. To stay upright 2 to 3 hours after a meal. C. Limit the intake of acid-stimulating food and drink. D. All of the above. Answer is D. All of the above. All of the answers are correct. A high-protein, low-fat diet is appropriate for patients with GERD, as following this diet helps prevent symptoms of acid reflux. A high-fat diet may delay gastric emptying, leading to more acid reflux. Remaining upright will help keep pressure off of the esophageal sphincter and allow the muscle to work appropriately. Limiting the intake of acid-stimulating food and drink will also prevent heartburn by calming the esophageal lining and preventing the esophageal sphincter from weakening. A patient, who weighs 143 pounds, has a prescription for garamicin at 2 mg per kg, IV, every 8 hours. There is 100 mg in 50 ml solution on hand. How much ml of garamycin should the nurse administer with each dose? A. 45. B. 55. C. 65. D. 75. Answer is C. 65. Weight of the patient in kg equals 143 over 2.2 equals 65 kg. Prescription dose of garamycin equals 2 mg per kg 8 hourly. Dose required by patient equals 65 times 2 equals 130 mg. According to the question, 100 mg garamycin is there in 50 ml solution. That is, 1 mg garamycin is there in 50 over 100 ml of solution. If so, 130 mg of garamycin is there in 50 over 100, multiplied by 130 ml solution. Equals 65 ml. A patient is not to eat or drink anything 24 hours before a colonoscopy. A. True. B. False. Answer is B. False. A patient may be instructed to not eat any solid foods up to 24 hours prior to a colonoscopy. However, clear liquids are typically allowed until midnight prior to the procedure up to a couple hours prior to the procedure. The nurse will need to verify the orders given by the physician. Which of the following symptoms would a patient exhibit with hyperthyroidism? A. Intolerance to cold. B. Decreased bowel movements. C. Slow heart rate. D. None of the above. Answer is D. None of the above. A patient with hyperthyroidism will present with the opposites of the listed symptoms. Too much thyroxine is produced, causing the body's metabolism to rise. This leads to an intolerance to heat, a decrease in weight gain, increased bowel movements, a rapid heart rate, and warm, clammy skin. A patient is having a tonic-clonic seizure. A nurse should take which of the following steps? A. Put a pillow under the patient's head. B. Put restraints on the patient. C. Use a tongue blade on the patient. D. Lay the patient on his back. Answer is A. Put a pillow under the patient's head. Putting a pillow under the patient's head is an acceptable way to prevent injury to the patient until the seizure has completed. A patient with a history of schizophrenia says the medical staff is secretly employed by the CIA to take me out. The nurse should respond as follows. A. The CIA protects us and is not out to hurt you. B. No other patient thinks that. C. I want to help you, not harm you. It must be frightening thinking people want to hurt you. D. When did you first start having these thoughts? Answer is C. I want to help you, not harm you. It must be frightening thinking people want to hurt you. The best therapeutic communication with a schizophrenic patient is to acknowledge their fears while also developing rapport with the patient as a nurse. This statement best meets those needs. A patient with schizophrenia will truly believe in the statements they are making, so the nurse should not try to convince the patient they are wrong, as this may develop distrust between the nurse and patient. The focus should remain on the patient and their beliefs. The nurse should not bring other patients into the conversation. As to answer option D, this statement does not acknowledge that the patient's thoughts are their reality. The patient may also not know the answer to this question, and the nurse will not be able to develop rapport with the patient. Which of the following patients should a nurse recognize as having an increased risk of breast cancer while doing breast cancer screening? A. A 44-year-old who has had 5 children. B. A 28-year-old who is breastfeeding her first child. C. A 35-year-old who started her menstrual cycle at age 12. D. A 61-year-old who has not had children. Answer is D. A 61-year-old who has not had children. The risk for breast cancer is increased in elderly patients who have not had children. Patients who have had children are at less risk for breast cancer than those who have not had children. Breastfeeding decreases the risk for breast cancer. A patient who started her menstrual cycle at age 12 would be at decreased risk for breast cancer. Patients with irregular cycles or who started at an earlier age may be at an increased risk for breast cancer. A patient is scheduled for surgery to have his appendix amputated due to acute appendicitis. The patient says, "I don't think I need surgery now because I feel better." A nurse should respond as follows. A. I will have your spouse explain the procedure to you again. B. I will call your doctor to explain the procedure to you. C. I will explain the procedure to you and answer any questions you have. D. Your appendix may rupture and that could cause serious problems. Answer is B. I will call your doctor to explain the procedure to you. It is most appropriate to notify the doctor that the patient is rethinking about receiving the surgery. The doctor will need to discuss their options again and reinforce to the patient that surgery is required or not. It is not appropriate for the spouse to explain the procedure to the patient. This should be done by medical staff. The patient may have questions that can only be answered by the doctor, therefore the doctor should be notified. The nurse may not be able to explain the procedure appropriately and may cause the patient to distrust the medical staff, therefore the doctor should be notified as they may need to receive consent a second time. While preparing for discharge, a patient makes a statement to the nurse, "I'm not sure I will be able to take care of myself at home." Who is the most appropriate team member to report this statement? A. Doctor. B. Physical therapist. C. Case manager. D. Director of nursing. Answer is C. Case manager. The case manager is the most appropriate healthcare team member to report this kind of statement to, especially around discharge. An assessment may need to take place regarding the living and financial situation of the patient. The doctor and director of nursing would most likely refer the nurse back to the case manager, so it would be appropriate for the nurse to report this statement to the case manager first. A nurse just started a blood transfusion for a patient with a hemoglobin of 6. The patient says, "I feel hot, my stomach hurts, and I am having difficulty breathing." What should be the nurse's first action? A. Notify the physician immediately. B. Stop the infusion. C. Take vital signs. D. Call a code. Answer is B. Stop the infusion. The first action should be to stop the transfusion immediately once the patient complains of any unusual symptoms. The patient is reporting symptoms of a transfusion reaction, therefore the transfusion should be stopped to prevent the patient from worsening. The provider should be notified immediately after stopping the transfusion. Vital signs should be taken as quickly as possible or as instructed by the provider after the transfusion has been stopped and the physician has been notified. A code should be called if the patient becomes unresponsive. A rapid response could be called if the patient is at risk of destabilizing. The patient has only one IV site with a continuous infusion of lactated Ringer's solution. The provider has prescribed ceftriaxone 100 mg in normal saline 50 ml to be given IV now. What should be the nurse's first action? A. Mix the ceftriaxone into the normal saline and piggyback into the primary infusion. B. Insert a secondary IV so the infusions can run simultaneously. C. Stop the lactated ringers solution and start the ceftriaxone now. D. Check the IV compatibility of the two medications. Answer is D. Check the IV compatibility of the two medications. The nurse's first action after receiving the new IV medication order should be to check the Y-site compatibility of the two IV infusions. Depending upon the response, the nurse may need to start a new IV or run the medications into the same IV. In this case, the IV compatibility will show as incompatible for lactated ringers and ceftriaxone, so these medications should not be run on the same IV line. If possible, the continuous infusion should not be stopped unless an IV access is obtained, or the physician gives the order to pause the continuous infusion while the antibiotic is given. Which of the following lab tests would be considered point-of-care testing? A. Urinalysis. B. Sputum culture. C. Complete metabolic panel. D. Blood glucose. Answer is D. Blood glucose. A blood glucose would be considered a point-of-care test as the test can be completed at the bedside with the result given immediately. A urinalysis, sputum culture, or complete metabolic panel would not be considered point-of-care tests because these tests need to be run in a laboratory setting with specialized equipment not available at the bedside. The nurse enters the room of a patient complaining of lower back pain after a left hip replacement surgery. What non-pharmacological intervention would not be appropriate? A. Reposition the patient onto the left side. B. Massage the patient's back. C. Lower the head of the bed and elevate the patient's legs onto a pillow. D. Apply a warm pack to the patient's back. Answer is A. Reposition the patient onto the left side. If possible, the patient should not be repositioned onto the side where the hip surgery took place as this may cause decreased circulation or improper healing to the hip or cause more pain to the patient. The patient can be repositioned from supine to the right side. Massage is an appropriate method for nursing staff to use in decreasing pain for the patient. It is appropriate to lower the head of the bed to elongate the patient's back. The patient's legs may be elevated to prevent swelling and pressure ulcers. The application of heat to a painful area is appropriate. It would be acceptable for the nurse to obtain a doctor's order prior to heat application. The nurse notices a CNA using an alcohol-based hand sanitizer after walking out of the room marked as enteric contact precautions. What should the nurse's response be? A. Nothing, as the CNA has appropriately washed their hands after leaving the room. B. Tell the CNA they need to wear a mask in the room. C. Tell the CNA they should dispose of their gloves outside of the room. D. Tell the CNA they need to wash their hands with soap and water. Answer is D. Tell the CNA they need to wash their hands with soap and water. A room marked with enteric contact precautions indicates that normal alcohol-based hand sanitizer will not remove the bacteria present in the room. Hand washing with soap and water should be used instead of hand sanitizer. A mask is not indicated with enteric contact precautions. The CNA should dispose of gloves inside the room to contain the bacteria within the room, then hands should be washed with water and soap. A nurse is making a home health visit in a home of an elderly couple. The wife states regarding her husband, the patient, he always sits in that chair all day long. Which of the following should the nurse consider the patient at risk for? A. Pressure ulcer. B. Deep vein thrombosis. C. Constipation. D. All of the above. Answer is D. All of the above. The patient is at risk for all the listed conditions related to decreased mobility. Pressure ulcers form as the skin layers break down between the chair or bed surface and bone. This may happen due to the patient remaining in one position too long. This patient may be at risk for pressure ulcers to his sacrum or areas where his leg meets the footrest. Patients have been shown to be higher risk for deep vein thrombosis with decreased mobility. The patient should ambulate multiple times a day to lower his risk for DVT. Constipation is another common side effect of decreased mobility as the GI system slows. Which of the following statements to the type 2 diabetic patient by the nurse is correct? A. Eat less fruits and vegetables and more grains. B. Try to wear closed-toe shoes whenever ambulating. C. Minimize physical activity to prevent fatigue. D. Check your blood sugar only after meals. Answer is B. Try to wear closed-toe shoes whenever ambulating. The correct statement by the nurse is that the patient should wear closed-toe shoes when ambulating. Patients with diabetes are at high risk for impaired sensation in their lower extremities and may develop wounds that are difficult to heal. Patients with diabetes should be encouraged to eat more fruits and vegetables as part of a healthy blood sugar regulating diet. Increasing physical activity is another way the patient with diabetes can regulate blood sugar levels. If the diabetic patient is checking blood sugars, the levels would normally be checked prior to meals, typically to determine a dose of insulin. A patient is being discharged with a new diagnosis of congestive heart failure. Which of the following statements made by the patient indicate understanding of the diagnosis? A. I can drink as much fluid as I want. B. I should notify my doctor if my feet start to swell. C. Weight gain of 3 to 5 pounds in one day is to be expected. D. It is normally to have difficulty breathing at night. Answer is B. I should notify my doctor if my feet start to swell. The patient should notify the physician if edema starts developing in the lower extremities. This indicates more pressure on the heart and can cause complications. Patients with congestive heart failure need to have a limited fluid intake, typically around 2 liters per day to prevent fluid overloading. The patient should be aware this includes all types of fluids, not just water. Weight gain of 3 to 5 pounds in one day should be reported to the physician as this is a significant weight increase and may indicate fluid retention. The patient's medications may need to be adjusted. The patient complaining of difficulty breathing at night is experiencing pulmonary edema, a condition in which fluid builds up into the lungs. This symptom should be reported to the physician immediately. A nurse working in the telemetry unit receives a call that a patient's EKG rhythm has transitioned into atrial fibrillation. Which medication is the patient likely to receive long-term in relation to this diagnosis? A. Warfarin. B. Heparin. C. Furosemide. D. Albuterol. Answer is A. Warfarin. Warfarin is a common medication given long-term in the management of atrial fibrillation to prevent the development of blood clot, or thromboses, that can cause blockages in the heart or lungs. Heparin, while used to prevent thrombosis in atrial fibrillation, is not usually administered long-term as it is an IV or subcutaneous injection. Furosemide is given as a diuretic in decreasing fluid retention. It is normally given to patients with congestive heart failure. Albuterol is typically a drug that is inhaled in the treatment of chronic obstructive pulmonary medication or asthma as a rescue medication. It is contraindicated in atrial fibrillation. A patient has incentive spirometry ordered 10 breaths 4 times a day after a cholecystectomy. The patient is asking why they need to perform this action. Which of the following would not be a reason the patient should use the incentive spirometer? A. To decrease lung capacity. B. To gently exercise the lungs. C. To improve recovery time. D. To prevent pneumonia. Answer is A. To decrease lung capacity. Using an incentive spirometer will increase lung capacity, opening the bronchioles, and allowing for better oxygenation throughout the body. Using an incentive spirometer gently exercises the lungs and will encourage the patient to take long and deep breaths instead of short and shallow breaths which are common following surgery. Maintaining adequately expanded lungs and allow better oxygenation through the bloodstream will improve recovery times, allowing for the patient to start ambulating sooner as well as encourage proper healing to the surgical site. Incentive spirometry use prevents pneumonia by keeping bronchioles open and clear, minimizing the sustainable environment for pneumonia to develop. A nurse is changing the dressing for a post-op bilateral knee amputation patient. The nurse notes the patient refuses to look at the limb while the dressing is being changed but asks the nurse about their personal life instead. Which nursing care plan should the nurse implement for the patient related to this action? A. Disturbed body image. B. Altered sleep pattern. C. Impaired memory. D. Impaired social interaction. Answer is A. Disturbed body image. A patient with loss of limb may be experiencing disturbed body image. The nurse should be sensitive to the patient's emotional and mental acceptance of the loss and incorporate therapeutic communication as the patient allows. Acceptance may take time and the patient should not be pressured into looking at the limb. The patient may be experiencing altered sleep patterns related to the surgery, however the patient refusing to look at the limb indicates disturbed body image. The patient remembers the limb is there and is refusing to look at it, therefore impaired memory does not appear to be the issue. The patient does not appear to have any issues communicating with the nurse, so the patient is more likely experiencing disturbed body image related to the loss of the limb rather than impaired social interaction. Which method should be the last resort in assisting a patient who is experiencing mild anxiety? A. Therapeutic communication. B. Deep breathing. C. Progressive muscle relaxation. D. Administration of Haldol. Answer is D. Administration of Haldol. Non-pharmacological methods should be used prior to pharmacological methods. Haldol is normally given to patients experiencing severe anxiety or agitation and should be used as a last resort. A patient may benefit from the nurse sitting with them and providing calm conversation over the anxiety-causing issue. Deep breathing is a well-known calming technique used to calm the nervous system and can help in cases of anxiety or panic attacks. Progressive muscle relaxation can be used to encourage the patient into a more relaxed state. The nurse can assist the patient to lay on the bed and provide instructions to the patient in a slow, calm voice. Progressive muscle relaxation would be helpful for mild anxiety. In which of the following ways can the nurse promote the sense of taste for an older adult? A. Mix foods together on the dinner tray. B. Avoid cologne, air fresheners, or room deodorizers. C. Encourage the client to chew food thoroughly. D. Discourage the use of salt or seasonings with prepared food. The answer is C. Encourage the client to chew food thoroughly. As clients age, their sense of taste may diminish, reducing the joy that comes with eating. A nurse can promote the sense of taste for a client by encouraging him to chew his food thoroughly while eating. This results in longer contact of food with the taste buds and a greater chance of tasting the food. Which of the following is classified as a prerenal condition that affects urinary elimination? A. Nephrotoxic medications. B. Pericardial tamponade. C. Neurogenic bladder. D. Polycystic kidney disease. The answer is B. Pericardial tamponade. A prerenal condition is that which causes reduced urinary elimination due to a diminished blood flow to the kidneys. A condition such as cardiac tamponade affects the heart's ability to pump adequate amounts of blood, thereby reducing blood flow to vital organs throughout the body, including the kidneys. A nurse is assessing an African American client for risks of a pressure ulcer. Which of the following best describes what the nurse might find with an early pressure ulcer in this client? A. Skin has a purple, bluish color. B. Capillary refill is 1 second. C. Skin appears blanched at the pressure site. D. Tinting appears when checking skin turgor. The answer is A. Skin has a purple, bluish color. When assessing for signs of developing pressure ulcers in a client with dark skin, decreased circulation may not always be readily apparent. For instance, blanching, the red undertones seen in light-skinned clients, will not always be present. Instead, the skin of an early pressure ulcer may develop a purple or bluish color. At the beginning of the shift, a nurse receives report for her daily assignment. Which of the following situations should the nurse give first priority? A. A diabetic client with a blood glucose level of 195 mg per deciliter. B. A family member of an elderly client who has questions. C. A client with COPD with an oxygen saturation of 84%. D. A client who requires assistance to use the bathroom. The answer is C. A client with COPD with an oxygen saturation of 84%. When prioritizing needs of clients, the nurse must begin with the unstable client or manage conditions that affect airway, breathing, or circulation first. The client with COPD has a condition that affects breathing and is exhibiting decreased oxygen saturation levels, therefore, this client should be the first priority. Mr. W has orders for a physical therapy consult. The nurse contacts the appropriate department, but 12 hours later, no one has come to see the client. Which is the most appropriate action of the nurse? A. Call the supervisor and file a complaint against the physical therapy department. B. Contact the physician to notify him that the orders were not carried out. C. Assess the client's activity level by assisting with ambulation using a gait belt. D. Contact the physical therapy department again and repeat the order. The answer is D. Contact the physical therapy department again and repeat the order. Nurses must typically work as part of a larger interdisciplinary team that involves collaboration with other professionals. In order to fulfill the client's needs, communication between disciplines should remain respectful, with clear directions about each discipline's responsibilities. Communication between all parties minimizes confusion about the client's care. Mr. W has orders for a physical therapy consult. The nurse contacts the appropriate department, but 12 hours later, no one has come to see the client. Which is the most appropriate action of the nurse? A. Call the supervisor and file a complaint against the physical therapy department. B. Contact the physician to notify him that the orders were not carried out. C. Assess the client's activity level by assisting with ambulation using a gait belt. D. Contact the physical therapy department again and repeat the order. The answer is D. Contact the physical therapy department again and repeat the order. Nurses must typically work as part of a larger interdisciplinary team that involves collaboration with other professionals. In order to fulfill the client's needs, communication between disciplines should remain respectful, with clear directions about each discipline's responsibilities. Communication between all parties minimizes confusion about the client's care. The B in the SBAR acronym stands for A. Background. B. Basic. C. Beginning. D. Break. The answer is A. Background. The B in the SBAR acronym stands for background. The SBAR is a communication tool used between providers that regulates the type and amount of information given. When contacting a physician, the nurse provides information about the situation, the client's background, the nurse's assessment, and further recommendations. Which of the following nursing interventions is appropriate for a client who is suffering from a fever? A. Avoid giving the client food. B. Increase the client's fluid volume. C. Provide oxygen. D. All of the above. E. Both B and C. The answer is E. Both B and C. Interventions for a client who is suffering from a fever include increasing the client's volume of fluid and providing oxygen. A fever increases the body's metabolism, causing the client to breathe at a faster rate and increasing the work of the heart. The client is at risk of fluid loss due to increased respiration and sweating. The increased work of the heart requires more oxygen to maintain perfusion to the tissues. A client has started sweating profusely due to intense heat. His overall fluid volume is low and he has developed electrolyte imbalance. This client is most likely suffering from A. Malignant hypothermia. B. Heat exhaustion. C. Heat stroke. D. Heat cramps. The answer is B. Heat exhaustion. Heat exhaustion occurs when a person has enough diaphoresis that he becomes dehydrated. Intense sweating can cause both fluid and electrolyte imbalances. Untreated heat exhaustion can lead to heat stroke, which results in organ damage, loss of consciousness, or death. A nurse is attempting to assess a client's pulse in his foot. She palpates the pulse on the anterior aspect of his ankle, below the lower end of the medial malleolus. Which type of pulse is this nurse taking? A. Dorsalis pedis. B. Popliteal. C. Posterior tibial. D. Femoral. The answer is C. Posterior tibial. The nurse can palpate the posterior tibial pulse to assess circulation to the foot and ankle. The posterior tibial pulse is felt by palpating the inner side of the ankle, behind the medial malleolus. Mrs. J is in the adult ICU on a ventilator. The nurse caring for her recognizes that her endotracheal tube needs suctioning. Based on the nurse's understanding of this procedure, what level of pressure should the nurse apply while suctioning? A. 70 to 80 millimeters of mercury. B. 100 to 120 millimeters of mercury. C. 150 to 170 millimeters of mercury. D. 200 millimeters of mercury. The answer is B. 100 to 120 millimeters of mercury. When suctioning the endotracheal tube of an adult client, the nurse should set the suction apparatus at a level no higher than 150 millimeters of mercury, with a preferable level between 100 and 120 millimeters of mercury. Suction pressure that is too high can contribute to the client's hypoxia. Alternatively, too low of suction pressure may not clear adequate amounts of secretions. The nurse caring for Mrs. J is prepared to suction her endotracheal tube. Which of the following interventions will reduce hypoxia during this procedure? A. Hyperoxygenate Mrs. J for up to 60 seconds prior to starting. B. Administer 15 cc of sterile fluid into the tube prior to suctioning. C. Suction for no longer than 30 seconds at a time. D. Wait 30 seconds after suctioning before attempting again. The answer is A. Hyperoxygenate Mrs. J for up to 60 seconds prior to starting. Before suctioning a client's endotracheal tube, the nurse should provide extra oxygen for approximately 30 to 60 seconds. Hyperoxygenating a client before suctioning increases oxygen delivery to the tissues and reduces hypoxia that may develop during the procedure. Which of the following conditions is a contraindication for performing a diagnostic peritoneal lavage? A. A client who is 9 weeks pregnant. B. A client with a femur fracture. C. A morbidly obese client. D. A client with hypertension. The answer is C. A morbidly obese client. Diagnostic peritoneal lavage is contraindicated in clients who are morbidly obese because excess body fat makes finding essential landmarks for this procedure difficult. Additionally, the equipment used for the procedure may not be large enough to accommodate an obese person. Finally, morbid obesity puts excess strain on the cardiovascular and respiratory systems, such that anesthetic agents used during the procedure could cause further complications. Which of the following is an example of client handling equipment? A. Wheelchair. B. Height adjustable bed. C. Shower chair. D. Call light. The answer is B. Height adjustable bed. Client handling equipment is designed to reduce the stress and workload on nurses who must assist, turn, or lift clients. This equipment decreases the risk of injuries associated with improper lifting. A height adjustable bed raises the client up to a proper working height for the nurse who must provide assistance. Which practice will help to reduce the risk of a needle stick injury? A. Only expose the end of the needle once ready to enter the room for the procedure. B. Always place the cap back on a needle after it has been used. C. Keep a sharps container nearby where it can be easily accessed. D. Pass needles between nurses by using the handover technique. The answer is C. Keep a sharps container nearby where it can be easily accessed. When administering an injection or using sharps for a procedure, the nurse can minimize safety risks by keeping a sharps container nearby. This provides easy access for quick disposal to prevent the possibility of a needle stick. Needles should never be recapped after use, and nurses should always exchange needles from a central area rather than passing them between workers. Which of the following is an organizational factor that affects workplace violence directed at nurses? A. Clients who have short hospital stays. B. The presence of security guards. C. Restricted client areas. D. Understaffing of nursing personnel. The answer is D. Understaffing of nursing personnel. Understaffing of nursing personnel may be an organizational risk associated with workplace violence for nurses. Understaffing involves too few nurses on duty, which may not be enough to meet client needs at the time or may result in longer delays for provision of care. Greater amounts of activity and diminished numbers of nurses to provide care may result in aggression, violence, or anger from clients or families directed toward staff. A client has been diagnosed with a form of terminal cancer and has started receiving hospice care. The nurse notes that both the client and his family avoid talking about the diagnosis. All attempts at discussion result in changing the subject. The nurse recognizes that this family is exhibiting A. Closed awareness. B. Mutual pretense. C. Open awareness. D. Powerless assessment. The answer is B. Mutual pretense. Mutual pretense is a form of awareness as a response to death or dying in which those involved avoid discussing the situation. In a case of terminal illness, A client and his family are aware of the diagnosis, but the client may not want to talk about the situation for various reasons, such as saving his family from feelings of grief, fear of the future, or discomfort with talking about feelings. A nurse is preparing to talk about body changes with a client who just had a bilateral mastectomy. Which of the following actions of the nurse is most appropriate during this discussion? A. Provide a room that offers minimal distractions. B. Ask closed-ended questions to allow the client to think about her situation. C. Write detailed notes during the conversation to track important information. D. Ask personal questions about the client's background to determine how the procedure has affected her. The answer is A. Provide a room that offers minimal distractions. When preparing to talk with a client about a difficult subject, the nurse can provide an environment that is private and that offers minimal distractions. This gives the client an opportunity to open up about personal feelings without being interrupted, and may provide more open communication between the nurse and client. A nurse is attempting to speak with a client about his personal feelings of self-esteem and self-concept. Which of the following questions is most appropriate for assessing a client's personal identity? A. What is your educational background? B. Are your parents still living? C. What do you like about your life right now? D. Where do you see yourself in 10 years? The answer is C. What do you like about your life right now? When assessing a client's personal identity, the nurse should focus on questions that determine how the client feels about himself. This may mean asking questions that help him identify his personal strengths and weaknesses, as well as how he thinks others see him. A drug form in which medication particles are instilled into a liquid and combined through agitation of the solution is called A. Suspension. B. Elixir. C. Syrup. D. Tincture. The answer is A. Suspension. A suspension is a type of medicine that combines medication particles with a liquid solution. When not administered, medication particles within the suspension may settle to the bottom, requiring the nurse to shake the solution to mix. Suspensions are typically given as oral solutions. Following a dose of medication, a client develops inflamed mucous membranes and nasal discharge. What type of minor reaction is this client experiencing? A. Urticaria. B. Pruritus. C. Hives. D. Rhinitis. The answer is D. Rhinitis. Rhinitis may occur as a mild reaction following some types of medication administration. Rhinitis involves itchy or inflamed mucous membranes, particularly around the eyes, nose and mouth. The client may also develop swelling of the nasal passages or clear discharge. Mr. Y is receiving medication through a catheter that has been placed into the subarachnoid space of his spinal column. What route of medication administration is this called? A. Intrapleural. B. Intraosseous. C. Intrathecal. D. Intraperitoneal. The answer is C. Intrathecal. Medications administered through the intrathecal route are given through a catheter that has been placed into the subarachnoid space of the spinal column. These medications are given into cerebrospinal fluid, often for pain control. Placement of an intrathecal catheter is typically done by a trained physician or advanced practice nurse. Which of the following complications is associated with premature rupture of membranes in the pregnant client? A. Vaginal or cervical lacerations. B. Shoulder dystocia. C. Uterine rupture. D. Choriamnionitis. The answer is D. Choriamnionitis. Premature rupture of membranes occurs when the amniotic sac of a pregnant client has ruptured before the onset of labor. The client may be at increased risk of choriamnionitis, which occurs as inflammation of the membranes of the placenta. Infection may develop when bacteria sent into the uterus without the protection of the intact amniotic sac. A nurse is caring for a child whose parents live in a home with several other unrelated children and adults. Some of the people who live in the home have visited, and the nurse discovers that this group all shares finances and living conditions. What type of family is this most likely an example of? A. Blended family. B. Communal family. C. Foster family. D. Extended family. The answer is B. Communal family. A communal family is a group classified as a non-traditional family. In this situation, adults who are not related may live and work with other adults and their children all together in a household. The communal family may share expenses, food, and childcare in the same way as a traditional family. A nurse is educating a female client about progesterone. Which of the following information is appropriate to include in this teaching? A. Progesterone helps the body to maintain pregnancy. B. Progesterone stimulates the breasts to secrete milk. C. Progesterone causes uterine contractions during delivery. D. Progesterone causes development of masculine characteristics in women. The answer is A. Progesterone helps the body to maintain pregnancy. Progesterone is a hormone that is produced by the ovaries in women. Progesterone affects the tissue of the endometrium by developing the lining of the uterus in support of embryo implantation. In pregnant women, progesterone nourishes the uterine lining and limits uterine contractions to prevent miscarriage. Which of the following is considered a Schedule II drug? A. Alprazolam. B. Hydrochlorothiazide, HCTZ. C. Ibuprofen. D. Acetaminophen. E. Oxycodone, acetaminophen. The answer is E. Oxycodone, acetaminophen. Schedule II drugs are monitored drugs that have an accepted medical use and are highly addictive, both physically and psychologically. Schedule II drugs include oxycodone, acetaminophen, fentanyl, and hydromorphone. The nurse has just administered the first doses of the following medications. Which is most likely the cause of a new onset headache? A. Magnesium hydroxide. B. Sumatriptan. C. Pantoprazole. D. Metoclopramide. E. Sucralfate. The answer is C. Pantoprazole. The development of a headache is most likely a side effect of pantoprazole, a proton pump inhibitor. Sumatriptan is a medication that is commonly used to relieve migraine headaches. Metoclopramide may cause restlessness and anxiety. Sucralfate may cause constipation. Side effects are rarely seen with magnesium hydroxide. They include nausea, constipation, and aluminum deficiency due to overexcretion via binding phosphate in the stomach. A nurse is preparing a client to receive pain medication to aid with the discomfort of labor. The client is being prepped to undergo a pudendal nerve block. The nurse will explain the effects of such a block. A pudendal block is responsible for which of the following pharmacological actions in regards to providing anesthesia during labor? A. A local infiltration of the skin around the vaginal opening to provide superficial anesthesia to the skin. B. A type of anesthesia block to provide total anesthesia to the entire area, Injected into fifth lumbar space and may hinder the mother from pushing during the birth process. C. Provides complete anesthesia with injection into the subarachnoid space of the lumbar region of the spine. D. A block specifically formulated to block nerve impulses to the uterus to aid in mother to assist in pushing during the birth process. E. Provides relief of pain from an episiotomy, blocks nerve impulses associated with the vagina, the cervix as well as the perineum region. The answer is E. Provides relief of pain from an episiotomy, blocks nerve impulses associated with the vagina, the cervix as well as the perineum region. Epidental block is a useful type of anesthesia often utilized during the second stage of the labor process. It provides anesthesia for an episiotomy performed in the perineum area. What is the purpose of Beer's criteria? A. To list inappropriate drugs for infants. B. To list inappropriate drugs for the elderly. C. To list inappropriate laboratory tests for infants. D. To list inappropriate laboratory tests for the elderly. The answer is D. To list inappropriate drugs for the elderly. Beer's criteria is used in medicine as a list of drugs that should not be prescribed in the elderly. These drugs can have potentially disastrous complications for older adults, including falls and other serious injuries. Older patients undergoing palliative care typically do not need to follow Beer's criteria. You are the nurse taking care of a patient who is being treated with oral vancomycin, an antibiotic, for Clostridium difficile diarrhea. Which of the following choices best describes the mechanism of action of vancomycin? A. Inhibition of peptide elongation. B. Inhibition of topoisomerase II. C. Disruption of mycolic acid synthesis. D. Disruption of peptidoglycan cross-linkage. E. Inhibition of integrase. The answer is D. Disruption of peptidoglycan cross-linkage. The correct answer is disruption of peptidoglycan cross-linkage, as this is the mechanism of action of the antibiotic, vancomycin. Vancomycin has high clinical utility in medicine, as it can be administered orally to treat Clostridium difficile diarrhea, or intravenously to treat MRSA infections, among others. As such, it is important to be well aware of vancomycin in clinical practice. Inhibition of topoisomerase II is the mechanism of action of fluoroquinolone antibiotics, such as levofloxacin. Disruption of mycolic acid synthesis is the mechanism of action of antifungal medications. Inhibition of integrase is the mechanism of action of some antiretroviral drugs, as would be used in the treatment of diseases like HIV. Inhibition of peptide elongation is the mechanism of action of macrolide antibiotics, such as azithromycin. You are the nurse taking care of a patient who is receiving an antibiotic, clindamycin, for the treatment of an oral infection. Which of the following choices best describes the mechanism of action of clindamycin? A. Inhibition of tetraflate reductase. B. Prevention of folic acid synthesis. C. Inhibition of RNA transcription. D. Blockage of peptide elongation by binding 50S ribosome site. E. Inhibition of DNA gyrase. The answer is D. Blockage of peptide elongation by binding 50S ribosome site. This is the mechanism of action of the antibiotic, clindamycin. Inhibition of DNA gyrase is one of the mechanisms of action of fluoroquinolone antibiotics, such as levofloxacin. Inhibition of RNA transcription is one of the mechanisms of action of bacitracin, a topical antibiotic. Inhibition of tetraflate reductase is the mechanism of action of trimethoprim, an antibiotic that is often combined with sulfamethoxazole to inhibit folic acid synthesis. Prevention of folic acid synthesis is the ultimate mechanism of action of trimethoprim and sulfamethoxazole, both individually and when given together. The nurse is preparing to administer 250,000 units of medication to a patient. The ampule sent from the pharmacy contains 500,000 units per milliliters. How many milliliters should the nurse administer? A. 1.2 milliliters. B. 2.5 milliliters. C. 0.5 milliliters. D. 0 milliliters. The answer is C. 0.5 milliliters. Strength of medication equals 500,000 units per milliliters. Required dose equals 250,000 units. Milliliters of medication required equals 250,000, 500,000 milliliters. Equals 0.5 milliliters. The nurse is preparing to administer 100,000 units of medication to a patient. The ampule sent from the pharmacy contains 600,000 units per milliliters. How many milliliters should the nurse administer? A. 2.4 milliliters. B. 0.2 milliliters. C. 2 milliliters. D. 1.5 milliliters. The answer is B. 0.2 milliliters. Strength of medication equals 600,000 units per milliliters. Required dose equals 100,000 units. Milliliters of medication required equals 100,000 over 600,000 milliliters. Equals 0.16 milliliters. 0.2 milliliters. The nurse is preparing to administer a bag of heparin sodium solution with a mix of 120,000 units per 400 milliliters intravenously. At what rate should the nurse set the infusion pump if intending to deliver 1800 units per hour? A. 6.0 milliliters per hour. B. 7.8 milliliters per hour. C. 2.2 milliliters per hour. D. 1.3 milliliters per hour. The answer is A. 6.0 milliliters per hour. According to the question, 120,000 units is mixed in 400 milliliters. So 1 unit is in 400 over 120,000 milliliters. Hence 1800 units is in 400 over 120,000, multiplied by 1800 milliliters. Equals 0.6 milliliters. Hayden is a 9-year-old boy who has been admitted to the emergency room with a fever. He weighs 71 pounds. If the dosing guideline for acetaminophen is 10 mg per kg at 4-hour intervals, how many milligrams of acetaminophen should the nurse administer? A. 293 mg. B. 458 mg. C. 323 mg. D. 710 mg. E. 620 mg. The answer is C. 323 mg. 2.2 pounds equals 1 kg. So, 71 pounds equals 71 over 2.2 kg equals 32.3 kg. Prescription dose of acetaminophen equals 10 mg per kg. Dose required equals weight multiplied by prescription dose equals 32.3 multiplied by 10 equals 323 mg. An infant on his 14th day of life enters the emergency room. He are tachycardic, has poor skin turgor, and is crying without the formation of tears. The nurse knows that this child is showing symptoms of dehydration. The doctor orders fluid replacement of 544 milliliters over 5 hours. What is the drip rate of the infusion? A. 110 milliliters per hour. B. 108.8 milliliters per hour. C. 175 milliliters per hours. D. 200 milliliters per hours. E. 54.4 milliliters per hours. The answer is B. 108.8 milliliters per hours. The question says, over 5 hours to give 544 milliliters. So, in 1 hour give, 544 divided by 5, ml equals 108.8 milliliters. An 11-month-old child weighing 8.6 kilograms enters the emergency room with symptoms of a severe respiratory infection. Her physician suspects bacterial origin and prescribes ampicillin. The guidelines state that ampicillin is to be administered as 50 mg per kg per day in a dose 6 hourly. Ampicillin comes in 250 mg IV solutions of 50 milliliters. How many milliliters should the nurse administer for each dose? A. 25.5 milliliters. B. 250 milliliters. C. 107.5 milliliters. D. 50 milliliters. E. 21.5 milliliters. The answer is E. 21.5 milliliters. Weight of the baby equals 8.6 kg. Prescribed dose of ampicillin equals 50 mg per kg per day. Daily dose of ampicillin required for the baby equals 50 times 8.6 mg equals 430 mg. Dose of ampicillin to be given every 6th hourly equals 430 divided by 4 equals 107.5 mg. According to the question, available strength of ampicillin equals 250 mg in 50 milliliters. That is, 250 mg is there in 50 milliliters. 1 milligram is there in 50 over 250 milliliters. So, 107.5 milligrams is there in 50 over 250, multiplied by 107.5 milliliters equals 21.5 milliliters. Evelyn is a 3-year-old girl who has been bitten by her family's dog. She has had an incision and drainage, I and D, of her left hand to prevent infection, and she has been prescribed cefazolin. The guidelines for cefazolin are 25 milligrams per kg per day. Evelyn weighs 42 pounds. How many milligrams of cefazolin should the nurse administer daily? A. 524 milligrams. B. 367 milligrams. C. 819 milligrams. D. 475 milligrams. E. 1025 milligrams. The answer is D. 475 milligrams. 1 kilogram equals 2.2 pounds. Weight of Evelyn equals 42 pounds equals 42 divided by 2.2 kg equals 19 kg. Prescribed dose of cefazolin equals 25 milligrams per kg per day. Required dose for Evelyn equals 19.1 times 25 equals 475 milligrams per day. The nurse must administer 1 liter of sodium chloride solution over 8 hours. What is the appropriate rate in milliliters per hour that the nurse must set on the IV pump? A. 125 milliliters per hours. B. 150 milliliters per hours. C. 100 milliliters per hours. D. 200 milliliters per hours. The answer is A. 125 milliliters per hour. Required dose equals 1 liter in 8 hours equals 1000 milliliters in 8 hours. So, per hour dose equals 1000 divided by 8 equals 125 milliliters. The nurse prepares to administer naproxen to his patient. The physician has ordered 1,500 milligrams per day in divided doses. The medication label reads 1 tab equals 0.3 grams. How many tablets equal the daily dose of this prescription? A. 5.5 tab. B. 4 tab. C. 5 tab. D. 3.5 tab. E. 4.5 tab. The answer is C. 5 tab. Strength of 1 tab equals 0.3 grams equals 300 milligrams. Prescribed daily dose equals 1,500 milligrams. Tablets required equals 1,500 over 300 equals 5. The nurse administers 500 milliliters of piperacillin to a patient with an infection. It must be delivered over 2 hours. The IV has a drop factor of 5. How many drops will fall per minute, rounded to the nearest tenth, gutty per minutes? A. 24.0 gutty per minutes. B. 18.8 gutty per minutes. C. 22.4 gutty per minutes. D. 20.9 gutty per minutes. E. 20.4 gutty per minutes. The answer is D. 20.8 gutty per minutes. Prescribed dose of piperacillin equals 500 milliliters in 2 hours equals 250 milliliters in 1 hour equals 250 divided by 60 in 1 minute equals 4.17 in 1 minute. Drop factor equals 5. Drops per minute equals 5 multiplied by 4.17 equals 20.85 equals 20.9. The physician orders digoxin 250 microgram. The label states 1 equals 0.25 milligrams. How many tablets will the nurse administer to the patient for 1 dose? A. 1 tab. B. 1.5 tab. C. 2.5 tab. D. 2 tab. E. 0.5 tab. The answer is A. 1 tab. Strength of available digoxin equals 0.25 milligrams. 1 milligram equals 1000 mcg. So, 0.25 milligrams equals 0.25 times 1000 mcg equals 250 mcg. Prescribed dose equals 250 mcg. Tablets required equals required dose divided by available strength equals 250 mcg divided by 250 mcg equals 1. The nurse reads orders set by the primary care provider. She has prescribed 6,000 units of heparin 6th hourly subcutaneous for the patient. The label on the heparin vial reads 1 milliliter equals 10,000 units. How many milliliters will the nurse administer to the patient? A. 0.8 milliliters. B. 0.5 milliliters. C. 0.9 milliliters. D. 0.7 milliliters. E. 0.6 milliliters. The answer is 0.6 milliliters. Available strength of heparin equals 10,000 units per milliliters. Prescribed dose of heparin equals 6,000 units. Amount of heparin that needs to be administered equals prescribed dose divided by available strength equals 6,000 divided by 10,000 equals 0.6 milliliters. The nurse prepares to administer medications to his patients. One order reads 0.4 milliliters of potassium iodide for expectoration. The label on the medication reads 1 teaspoon equals 325 milligrams. How many milligrams are contained in this dose? A. 22 milligrams. B. 24 milligrams. C. 26 milligrams. D. 30 milligrams. E. 28 milligrams. The answer is C. 26 milligrams. Available strength equals 325 milligrams in 1 teaspoon. So, 1 teaspoon contains 325 milligrams. 1 teaspoon equals 5 milliliters. Hence, 5 milliliters contains 325 milligrams. 1 milliliter contains 325 divided by 5 mg equals 65 milligrams. 0.4 milliliters contains 65 multiplied by 0.4 milligrams equals 26 milligrams. The nurse prepares an order of 600 milligrams ampicillin IM 8th hourly. The medication is available in powdered form to be reconstituted with sterile water. The vial contains 2 grams ampicillin and instructs the nurse to reconstitute with 4.8 milliliters of sterile water to obtain a concentration of 400 milligrams ampicillin per milliliter. How many milliliters will the nurse administer per dose? Round to nearest tenth. A. 1.6 milliliters. B. 1.5 milliliters. C. 1.2 milliliters. D. 1.1 milliliters. E. 1.0 milliliters. The answer is B. 1.4 milliliters. Strength of prepared ampicillin equals 4.8 milliliters containing 2 grams. 1 gram equals 1000 milligrams, hence equals 4.8 milliliters contains 2000 milligrams. So, 1 milliliter contains equals 2000 divided by 4.8 equals 416.67 milligrams. Prescribed dose is 600 milligrams. So, 416.67 milligrams in 1 milliliter. 1 milligram in 1 divided by 416.67. 600 milligrams in 1 divided by 416.67 times 600 equals 1.44 milliliters equals 1.4 milliliters. The nurse prepares an order of 0.6 milligrams atropine IM. The label on the available medication reads 0.3 milligrams atropine per 0.5 milliliters. How many milliliters will the nurse administer? A. 2.25 milliliters. B. 1.75 milliliters. C. 1.0 milliliters. D. 1.25 milliliters. E. 0.5 milliliters. The answer is C. 1.0 milliliters. Available strength of atropine equals 0.3 milligrams divided by 0.5 milliliters. That is 0.5 milliliters contains 0.3 milligrams. 1 milliliter contains 0.6 milligrams. Dose being prepared equals 0.6 milligrams. Amount of atropine required equals dose required divided by available strength equals 0.6 divided by 0.6 equals 1. You start a patient in the intensive care unit on a drip of phenylephrine, as the patient is persistently hypertensive. You think that this will raise the patient's blood pressure because phenylephrine's primary mechanism of action is which of the following? A. Beta-2 adrenergic agonist. B. Alpha-1 adrenergic agonist. C. Beta-1 adrenergic agonist. D. Beta-1 adrenergic antagonist. E. Alpha-2 adrenergic agonist. The answer is B. Alpha-1 adrenergic agonist. Phenylephrine is frequently administered in the intensive care unit setting for patients with hypotension that is refractory to simple fluid resuscitation. It is a vasopressor, as its mechanism of action is to serve as an alpha-1 adrenergic agonist. The other choices are incorrect, as they represent the primary mechanisms of action of a handful of medications other than phenylephrine. An example of an alpha-2 adrenergic agonist would be methyldopa. An example of a beta-1 adrenergic agonist would be dobutamine. An example of a beta-2 adrenergic agonist would be albuterol. An example of a beta-1 adrenergic antagonist would be atenolol. You are the nurse taking care of a patient with asthma. The patient reports using his albuterol inhaler about once a month for wheezing and shortness of breath. Albuterol functions by which of the following mechanisms of action? A. Beta-1 adrenergic receptor antagonist. B. Beta-1 adrenergic receptor agonist. C. Beta-2 adrenergic receptor agonist. D. Beta-2 adrenergic receptor antagonist. E. Alpha-1 adrenergic receptor agonist. The answer is C. Beta-2 adrenergic receptor agonist. This question tests your knowledge of the mechanism of action of albuterol, a short-acting medication, frequently used in the treatment of acute asthma flares. Albuterol is an agonist of the beta-2 adrenergic receptor in the bronchial smooth muscle, which helps to dilate the bronchioles, often providing relief to patients who are suffering from asthma flares, as bronchospasm plays a large role in causing their symptoms. Additional effects of albuterol include increased heart rate, increased insulin release, and vasodilation among others. An example of a beta-1 adrenergic agonist would be dobutamine. An example of a beta-1 adrenergic antagonist would be atenolol. An example of a beta-2 adrenergic antagonist would be btoxamine. An example of an alpha-1 adrenergic agonist would be phenylephrine. You are taking care of a patient undergoing chemotherapy for breast cancer and she complains of nausea. Her physician prescribes her ondansetron for nausea relief. What is the mechanism of action of ondansetron? A. Dopamine D2 receptor antagonist. B. Serotonin 5-HT3 receptor agonist. C. Serotonin 5-HT3 receptor antagonist. D. Serotonin 5-HT3 receptor partial agonist. E. Dopamine D2 receptor agonist. The answer is C. Serotonin 5-HT3 receptor antagonist. Ondansetron functions by antagonizing the serotonergic 5-HT3 receptors both centrally in the brain and peripherally at vagal nerve endings. It is frequently given as an anti-nausea and antiemetic agent for patients with cancer undergoing chemotherapy and/or radiation therapy, as well as in post-operative patients, and for patients with gastroenteritis, among other uses. Ondansetron is neither a full nor a partial agonist of the 5-HT3 receptors, making those answer choices incorrect. Metoclopramide, which is another anti-nausea agent, is an antagonist of the dopamine D2 receptor, but ondansetron is not, so this choice is incorrect. Neither metoclopramide nor ondansetron is an agonist of the dopamine D2 receptor. You are a nurse at a gastroenterology practice and your patient is being started on ranitidine for gastroesophageal reflux disease, GERD. Which of the following describes the mechanism of action of ranitidine? A. Histamine 1 receptor antagonist. B. Proton pump inhibitor. C. Direct acid neutralization. D. Beta-2 adrenergic receptor agonist. E. Histamine 2 receptor antagonist. The answer is A. Histamine 2 receptor antagonist. This question tests your knowledge of the mechanism of action of the commonly prescribed antacid medication, ranitidine. Ranitidine functions by antagonizing the histamine 2 receptors within the parietal cells, acid-producing cells, of the stomach. This helps to reduce acid production, which can provide symptomatic relief to patients who suffer from epigastric burning, discomfort, and pain due to gastroesophageal reflux disease and peptic ulcer disease, among other conditions. An example of a histamine 1 receptor antagonist would be diphenhydramine. An example of a beta-2 adrenergic receptor agonist would be albuterol. An example of a proton pump inhibitor would be omeprazole. An example of a direct acid neutralizer would be calcium carbonate. Ethel is an 80-year-old woman who was admitted for dehydration. The nurse reports that she is not making 30 milliliters per hour of urine and the physician orders a bolus of 250 milliliters to be infused within 30 minutes. What is the correct drip rate for Ethel's infusion? A. 1000 milliliters per hour. B. 125 milliliters per hour. C. 400 milliliters per hour. D. 500 milliliters per hour. E. 250 milliliters per hour. The answer is D. 500 milliliters per hour. The minimum urine requirement per hour for most adults is 30 milliliters per hour. Based on a low finding, the physician may decide Ethel needs fluid replacement. Prescribed drip rate is 250 milliliters in 30 minutes. So, in 1 hour, the patient will get double volume, e 500 milliliters. Which of the following is the preferred location of intramuscular, IM, injection in infants? A. Biceps brachii. B. Deltoid. C. Vastus lateralis. D. Dorsogluteal region. E. Rectus femoris. The answer is C. Vastus lateralis. The vastus lateralis is the preferred site of injection in infants. Rectus femoris injections may be performed as a second choice. The dorsogluteal site should not be used in infants as the muscle is not developed and there is risk associated with the location of the sciatic nerve. Deltoid injections may be given to older children when the muscle becomes larger. The nurse is preparing to administer an intramuscular, IM, injection to a 4.8-pound infant. The nurse should position the needle at which angle? A. 90 degrees. B. 60 degrees. C. 30 degrees. D. 45 degrees. E. 15 degrees. The answer is D. 45 degrees. The preferred angle for intramuscular, IM, injections is 90 degrees. However, very small infants may require that the injection be given at a 45-degree angle. Based on patient condition, it is the nurse's responsibility to assess the needs of the patient and adjust care as appropriate. The injection site varies with the age of your child. The size of the needle depends on the weight of your child and the type of drug they are taking. When injecting, hold the shaft of the syringe in dart fashion. Insert needle directly through the skin at a right angle, 90 degrees angle, into the muscle. Give the injection quickly, and do not pull back on the plunger before injecting as this causes more pain. Discard the needle and syringe in a thick, plastic bottle or Sharps container with a lid. Bring it to your local pharmacy for disposal. The new pediatric nurse has just given a suppository to a 5-year-old boy. He has a bowel movement 7 minutes post-administration. Which action should the nurse take next? A. Inform the physician that the child has had a bowel movement. B. Examine the stool for the suppository. C. Give another full dose of the suppository. D. Give an additional half of the prescribed dose. E. Consult pharmacy. The answer is B. Examine the stool for the suppository. First, examine the stool for the suppository. Based on the findings, inform the physician. If the suppository was fully present in the stool, the physician may want to prescribe another dose. If not, he may choose to reorder half of the prescribed dose or none at all. The geriatric nurse is administering nightly medications to a 65-year-old woman with dysphagia. The patient is able to swallow crushed medications with thickened liquids. Which of the following medications should the nurse not crush? A. Potassium chloride. B. Acetaminophen. C. Sertraline hydrochloride. D. Bandoprazole R. E. Multivitamins. The answer is D. Bandoprazole R. Bandoprazole R should not be crushed. ER is an abbreviation for extended release. Extended release medications dissolve over a delayed period of time. Crushing the medication results in a faster rate of absorption by body tissues due to disruption of the coating that allows its extended release. The pediatric nurse is summoned to a room by the parents of a 2-year-old child. The peripheral IV line has been removed by the patient. When starting a new line, the nurse carefully chooses placement. The nurse should attempt to start the IV dash. A. As proximal as possible. B. As distal as possible. C. As medial as possible. D. As lateral as possible. E. As ipsilateral as possible. The answer is B. As distal as possible. Most peripheral IVs are started in the right or left arm. Distal to the arm would mean closest to the fingertips. When starting an IV, always start looking for potential sites closest to the fingertips and work upwards. If a vein is punctured and becomes unusable, it is possible to move above the previous attempt and start a successful IV. Jane is a 49-year-old woman who has recently had a peripherally inserted central catheter, PIC, placed. The nurse is teaching Jane how to flush her PIC. She knows that the teaching was effective when Jane states which of the following? A. I will use a 3 ml syringe or larger to flush my PIC line. B. I will use a 10 ml syringe or larger to flush my PIC line. C. I will use a 30 ml syringe or larger to flush my PIC line. D. I will use a 20 ml syringe or larger to flush my PIC line. E. I will use a 1 ml syringe or larger to flush my PIC line. The answer is B. I will use a 10 ml syringe or larger to flush my PIC line. One should always use a 10 ml syringe or larger to flush a PIC line. Smaller syringes place greater pressure on the line, which could result in damage. For example, a 3 ml syringe places greater pressure on a PIC line than a 5 ml syringe. The pediatric nurse must convince a 4-year-old boy to take his medication. Which phrase is the most acceptable? A. Your mother and I need you to take your medicine now. B. Will you please take your medication for us? C. If you don't take your medicine now, you will need to take a time out. D. If you take your medicine, I will give you a soda pop. E. It is time to take your medicine. It tastes just like candy. The answer is A. Your mother and I need you to take your medicine now. When convincing a child to take medicine, be straightforward and clear. Try not to offer the child a choice, as they likely won't take it. Stay away from using bribery, punishment, or comparing medicine to candy. Be honest about the taste of the medicine or risk losing the trust of the child. When performing a blood transfusion, which of the following procedures should not be adhered to in order to ensure safe delivery of blood product to the patient? A. Positively identify the patient identification. B. The tubing should be of a Y type to allow for fluid and blood product simultaneous infusion. C. The blood should be administered with isotonic solutions such as lactated ringers. D. The preferred gauge of the needle should be between 18 to 20 gauge to allow for improved flow. E. Blood must be used within the first 30 minutes of arrival to the unit. The answer is C. The blood should be administered with isotonic solutions such as lactated ringers. All are true except for the use of lactated ringers. This may cause a hemolytic reaction. Only normal saline 0.9% is utilized. A nurse is teaching a mother how to administer nystatin to her 2-month-old child in the treatment of oral candidiasis. Which of the following is an appropriate instruction given by the nurse to the mother? A. Place the medication in the child's bottle. B. Apply to the mouth using a cotton-tipped applicator. C. Give the medication before meals. D. Use a syringe to squirt the medication to the back of the mouth. E. Rinse the mouth post-administration. The answer is B. Apply to the mouth using a cotton-tipped applicator. Apply medication to the mouth using a cotton-tipped applicator. Give the medication after meals and avoid rinsing the mouth. The medication should have contact with the mucosa without being washed away. Do not place the medication in a child's bottle, they may refuse to eat due to the bitter taste of the medication. Do not use a syringe to squirt the liquid to the back of the mouth since the child will likely spit it out. Which of the following is an appropriate reason to delay antibiotic administration in a stable patient? A. A complete blood count has not been drawn today. B. The patient is nauseated. C. A stool sample must be obtained first. D. Blood cultures must be obtained first. C. A blood type and screen is not up to date. The answer is D. Blood cultures must be obtained first. Obtaining a set of blood cultures before treating a bacterial infection helps to individualize care and reduce antibiotic resistance. Using a narrow-spectrum antibiotic doesn't work against so many types of bacteria. By identifying specific bacteria in the blood, a narrow-spectrum antibiotic may be chosen. A physician may prescribe a broad-spectrum antibiotic initially and change treatment later based on the results of the blood cultures. A 65-year-old male client is being discharged from the hospital on warfarin therapy for chronic atrial fibrillation. The nurse is aware that the discharge teaching needs to include which of the following instructions? A. Use a blade when shaving, avoid electric razors. B. Increase intake of leafy green vegetables. C. Warfarin is a medication that does not require monitoring. D. When having dental procedures there is no need to discontinue warfarin. E. Alcohol should be limited to no more 1 to 2 servings on an occasional basis. The answer is E. Alcohol should be limited to no more 1 to 2 servings on an occasional basis. Warfarin is an anticoagulant. Alcohol can increase this effect, so it should be limited or avoided. Leafy greens contain vitamin K and can reverse the action of warfarin. Warfarin needs monthly monitoring to check client internal normalized ratio, INR. Dental and surgical procedures may require discontinuation temporarily to avoid excess bleeding. Electric razors are preferred. The nurse is teaching a patient who has just been prescribed antibiotics. The nurse knows that teaching has been effective when the patient states which of the following? A. My mother was previously prescribed the same antibiotic. I may take some of her leftover pills if my symptoms return. B. An antibiotic will help me get over my case of the flu. C. An antibiotic might help prevent me from getting sick in the future. D. I should use a backup method of birth control if I use oral contraceptives while taking antibiotics. E. I can stop taking the antibiotics when I feel better. The answer is D. I should use a backup method of birth control if I use oral contraceptives while taking antibiotics. Antibiotics may interfere with the function of oral contraceptives. A woman who is on oral contraceptives must use a backup method of birth control to prevent pregnancy. Antibiotics should only be taken as prescribed. They should be taken continuously until all pills are gone. It is dangerous to take leftover antibiotics. Antibiotics will not prevent illness and do not work against viruses such as influenza. Misuse of antibiotics may contribute to antibiotic resistance and the rise of antibiotic-resistant bacteria. A client with a history of chronic stable angina takes nitroglycerine when needed for an acute attack. Which of the following is not associated with the administration of nitroglycerine? A. The patient may experience orthostatic hypotension. B. The mechanism of action involves increase in cardiac contractility. C. To prevent degradation, nitroglycerine should be kept in a closed dark bottle. D. Nitroglycerine can be taken sublingually by tablet or metered spray. E. The medication relieves pain within 3 minutes and provides relief for up to 1 hour. The answer is B. The mechanism of action involves increase in cardiac contractility. Nitroglycerine is a short-acting nitrate. This class of medication works by relaxing arterial and venous smooth muscle, promoting vasodilation. This medication does not improve cardiac contractility. A nurse checks the lithium level of a 28-year-old patient that has been prescribed lithium citrate and sees the level is 1.5 milliequivalents per L, and verifies that the patient has not taken more than the prescribed medication. The nurse advises the client to A. Eat salty foods. B. Drink 4 glasses of water a day. C. Exercise more often. D. Eat more red meat. The answer is A. Eat salty foods. Low sodium diets when taking lithium mood stabilizing drugs can result in toxicity. The nurse should tell the patient to eat salty foods to increase sodium intake.